In men, the most common type of hair loss is male pattern baldness, also known as androgenetic alopecia. This condition is largely hereditary and related to hormones, particularly dihydrotestosterone, DHT. It typically begins with a receding hairline or thinning at the crown and may gradually progress to partial or complete baldness. Although it is not harmful to physical health, it can have a significant psychological impact. Women also experience hair loss, though the pattern is usually different. Female pattern hair loss often presents as overall thinning on the top of the scalp rather than complete baldness. Women are more likely to notice widening of the hair part or reduced hair volume. Hormonal changes related to pregnancy, menopause, thyroid disorders, or polycystic ovary syndrome, PCOS, can play a major role. Stress, nutritional deficiencies, such as iron or protein, and certain hairstyles that pull tightly on the hair can also contribute. Other common causes of hair loss in both men and women include medical conditions, medications, severe stress, rapid weight loss, and scalp infections. Temporary hair loss, known as telogen effluvium, may occur after illness, surgery, or emotional trauma, but hair often regrows once the underlying issue is resolved. Treatment options depend on the cause and severity of hair loss. They may include topical treatments, oral medications, lifestyle and dietary changes, stress management, or medical procedures such as hair transplantation.
Early diagnosis often improves treatment outcomes.
Hair loss is a widespread issue affecting both genders, with multiple possible causes. Understanding the underlying reason is key to managing the condition effectively and maintaining both physical appearance and emotional well-being. Please like, subscribe, and share this message.